Hello viewers, welcome back to our channel. I'm Anchor Priya Dasri. So varicose veins. Nowadays we are hearing this term varicose veins quite frequently, but most of the people are not having proper awareness on what is varicose veins. So in today's video, let's try to understand what is varicose veins and why it is important to understand the condition of varicose veins. To help us spread awareness, today we have India's #1 doctor for varicose veins, also interventional radiologist, also the MD of Avis Hospital, Dr. Rajah V Koppala garu with us. Let's talk to him. Hi sir.
Hi, how are you?
I'm good, thank you sir. So varicose veins, nowadays we are hearing this term quite frequently, but as discussed, most of the people are not having awareness about this. So what is varicose veins?
Right, so varicose veins is extremely common. Varicose veins is seen in more than nearly 25 to 30% of the people. So it's a very common condition. A lot of people suffer with it. But what exactly is it, right? So basically we have arteries that take the blood from the heart into the legs and they are the arterial system. Now the venous system, the veins are supposed to take the blood back from the feet back to the heart.
Okay.
So in the pathway of it going back to the heart, suppose there's a blockage or some valves are not working, then what happens, the blood doesn't go back up, but instead it comes down and settles down in the legs. So the blood starts accumulating in the legs. Sometimes the veins are swollen, but sometimes without swelling of the veins itself, there will be blackening of the legs, there will be discharge in the legs, there will be ulcers in the legs. So all sorts of things can happen in the legs. So these sort of side effects or these sort of effects that we see are primarily called as varicose veins.
Okay.
Now, the other name for varicose veins is called chronic venous insufficiency. Basically, it means that the veins are not sufficiently working and the blood is accumulating in the legs. So it's very, very important to realize this is a very common problem. It affects 25 to 35% of the people and the treatments are very easy and can be performed very happily. So basically good awareness is very important for the whole thing.
Yeah. So the following question definitely would be, is it harmful or life-threatening disease?
So it's a very good question that you ask, right? So the general thinking amongst public is that, if it's harmful or if it's going to kill me, is it going to be life-threatening, then I will take care of it. If it's little bit of a life issue, then I will not bother about it.
Yeah.
Now the problem with that is, see, varicose veins is not technically life-threatening. So nobody dies because of varicose veins. But it causes a lot of pain in the legs, it causes a lot of color change, it causes a lot of discomfort, it causes a lot of other problems to the patient. And a lot of patients with varicose veins who get ulcers cannot go to work. They are dependent on other people in their house to take them to some other place and they start suffering a lot. So not only do they suffer, but their family members also suffer because of that.
Yeah.
So this is all this causes a lot of what's called as morbidity. The word we use in medicine is not mortality sometimes because mortality means you die or with the problem, but morbidity, which basically is an indicator of the suffering. How much will you suffer because of varicose veins, right? And that is a big problem with varicose veins.
Okay.
So that a lot of patients have a lot of pain, a lot of discomfort, a lot of itching, a lot of problems with varicose veins.
Okay. So which age group people are having high chances of getting this disease, like early 30s or after 30s, like which age group people are having?
All age groups are prone to get varicose veins, but the most disease happens in 30 to 60 years in females. Whereas in males, we see little less of varicose veins, but I have treated patients as young as 16 years with the Klippel-Trenaunay syndrome. And I've treated people as old as 94 years. So I treat across spectrum. So there's no real age predilection, as you know, but it does definitely affect some populations more than other populations. So the classic age group is 30 to 60 years, women after 1 or 2 pregnancies, it is varicose veins.
Okay. So why it is more in women, sir? Like gender classification is there here?
Right. So in women, there's definitely more tendency to get varicose veins, primarily because I feel, and there's not much of theory, there's not much published in the books, but it's probably because during pregnancy, so the veins start in your legs and go through your tummy into the heart. On the way when it's going like that, sometimes they get pressed. The veins get pressed by the baby's weight during pregnancies.
Okay.
And at that time you see, so in pregnancy state, we see a lot of varicose veins. Lot of pregnant women get varicose veins.
Okay.
And after pregnancy, in some it reduces, in some it stays back. So we believe it's because of the pregnancy is a hypervolemic state, which is where there is no more volume of the blood. Along with that, there is some compression of the pelvic veins, which both of them lead to extensive varicose veins in the legs. So definitely there is some more incidence.
Okay. So what are the symptoms for this varicose veins disease, sir?
Right. So symptoms are important and I'm going to tell them in a minute. But we should also remember that you may not have these symptoms and still be having varicose veins. So you need to, if you have the symptoms, you should meet a doctor. But if you have some other symptom also, you should meet the doctor and make sure you don't have varicose veins. So we can give some interviews and podcasts like that, like this, but I cannot crystallize my 30 years of learning into 2 minutes of discussion here.
Correct.
So I think it's very important to understand that. But having said that, varicose veins, the most important symptom is pain in the legs, discomfort in the legs, discomfort in the calves. It looks very ugly. A lot of people cannot wear short clothes or even while bathing, it looks very ugly for them. In some people, there's spontaneous bleeding. So after a hot water bath, blood suddenly spurts. In some people, there's ulcers in the legs. They form wounds in the legs. In some people, they get frequent infections. So there are a lot of symptoms of varicose veins, and it's not specific to one. So a lot of people come and tell me, sir, I don't have pain, but this visible vein. That's fine. You may not have pain. Do you have other symptoms? Right. Similarly, somebody says, I have a lot of pain, but I cannot see the vein. So both these guys require scanning. Right? And we need to identify, is this the cause of varicose veins? Is the cause of your symptoms, or something else is the cause of your symptoms? So it's very important to understand that there is symptoms are very wide spectrum are there. And somebody may or may not have all the symptoms, and somebody may have only one symptom, and somebody may have no symptom. But again, if you have anything that untoward in your legs, like sudden pain, sudden swelling, sudden color change, anything like that happens, you should always consult a vascular doctor. So we use the word leg attack, meaning your legs are being attacked. Just like you have heart attack, we have leg attack. So leg attack also should be taken seriously, and you should meet a good vascular team like ours, where we identify the problem and tell you what the problem is.
Few people are also saying this is genetic. Is it true, sir?
Right. There's a huge genetic predilection for varicose veins. 94% of the people will have some genetic tendency to form varicose veins. So it's very, very common, and it causes a lot of damage, right? So I have operated many times son, mother, I've operated many times father, daughter. So like that many times. So it's a very common thing to see a genetic predilection. And it's very important for us to understand this, right? And very often they say that, it's because of standing. Yes. It is standing worsens the varicose veins. The reason for forming varicose veins is usually genetics. So we should be aware of that.
If this is just genetic and like we already know this may be coming in the future, what are the steps need to be taken to avoid this condition?
So if you have a genetic tendency to form varicose veins, you should remain slim, you should not add weight, you should exercise a lot, keep walking, do not eat inflammatory foods. A lot of fried foods are very bad for health, they will cause a lot of inflammation. A lot of processed foods, Maggies, all these are very, very bad for you. So keep having a natural diet that is rich in vegetables, and keep walking, keep exercising, and maintain a normal BMI.
So food habits and lifestyle also plays a major role here.
Yes, food habits and lifestyle do play a major role. In the food habits, what happens is we should remember that one food does not cause or prevent varicose veins, but generally we have noticed that inflammatory foods, which is fried foods, processed foods, which increase overall inflammation in the body, are bad for you, for vascular health. Similarly, chronic stress, not acute stress, meaning you not like the stress you get by running 2 kilometers. That's acute stress, it will relax, your body will relax after that. Chronic stress, thinking about some exam for 3 days, 15 days, 20 days will cause you to cause a lot of trauma. And that also causes a lot of vascular problems. Similarly, other lifestyle issues like alcohol plays a very major role in worsening varicose veins. Similarly, smoking also is terrible for your varicose veins. So you should not smoke, drink, maintain a healthy lifestyle, maintain a good BMI, do not eat inflammatory foods, and maybe a rich plant-based diet is very, very healthy for you, and that applies to all metabolic problems, including varicose veins.
So from the discussion, I have understood leg pains are the common symptom among most of the people. So what is this difference between normal joint-related pains? After that is usually all the people get. So what is difference between that pain and this varicose pain?
So joint pains are very simple to diagnose. So at least if you come to a very established clinic like ours, where we've seen more than 20-30,000 patients in our own lifetime. I have seen more than 60,000 patients in my lifetime. I can easily tell you which pain is what, right? So joint pain is on the joint or around the joint or behind the joint. If you press, there will be a tenderness in the patient. Whereas vascular pains are across the thigh, across the calf. Upon walking, it gets worse. Upon standing, it gets worse. Joint pains are usually worse off in the morning. That's called joint stiffness. So usually it's very easy to differentiate. And if you see my practice, right, almost because we tell you we will solve your leg pain, A lot of patients do come with joint pain also. And all I do them is, boss, you go to another doctor, an orthopedic surgeon, he'll take care of the joint pain. So we refer a lot of patients out also. Almost 40% patients have some other pain that is not vascular. But and we do give them the right guidance. But I still feel it's our duty to attend early leg pain and solve the problem, give you preventative measures, tell you what makes it prevent you and what makes you improve. All that is our duty, is what I feel. So I think that's where we do very well, and that's where we get so many patients also.
Okay. So like, if I'm not sure about, you said like out of 100 people, 30% people are having high chance of getting this vascular disease, varicose veins disease. So in order to understand if I'm there in that 30% or not, what are the tests I need to be taking?
So the most important test is somebody should do a Doppler exam in standing position. Only in standing position we can identify the problem. In lying down we cannot identify the problem. So it's very important to do a proper test of the test, identify where the blood is leaking and where the blood is pooling. Now in our system, this scan has always been free. We've always done as a part of the initial examination because we feel that when we send them outside, they can do it in lying down position, and sometimes it comes wrong. So then we'll have to again repeat the test. Also, in many people, no two people have the same vascular anatomy. They'll have different angles where the blood vessel goes and all that. So here we do what's called as the vascular mapping. We'll map everything. So the journey, when we do the procedure, becomes very easy. So ideally in a patient journey, right, whoever does the vascular care should also be the person diagnosing the problem. Should not be sent outside and the doctor marks something, he comes back with some other map. In that map you may get the right diagnosis, wrong diagnosis. So you can miss a lot of issues. Of course, we give the option of getting a scan outside to all our patients, and they sign a disclaimer before we do the scan, but this is what we think is the best thing.
But in our hospital, it is completely free.
It is completely free from last 10 years, and it continues to be free in all our 21 branches now.
Okay. So Indians mostly, people have been asking for home remedies, whatever the disease it may be. So are we having any home remedies for this disease also?
So home remedies are very harmful. Actually, I completely discourage home remedies. Some are useless, like putting some salt on that, turmeric on that. They put some hot water on that, oils on that, massage it. One patient today just now came and said he's been doing physiotherapy for 5 years. I said, it doesn't work. How does exercise remove varicose veins? It doesn't. But I think what's worse, and we should discuss, the big elephant in the room is that using these ointments and these oils that you get in the medical store. You go to a medical store, that guy gives you an ointment, that guy gives you something, and that you use, and invariably they contain either substances we don't know, that means we don't know what it does, or it contains substances that have high dose of steroids, high dose of antibiotics, a lot of damaging substances. So both are very bad for you, right? If anything, they damage your skin further, they reduce skin thickness, they make you easily prone for ulcers. So all that is a very damaging thing. Okay, so I think that is something we should be aware of. And we should be, we should not use it. Sometimes some people use things called leeches. There's a leech will bite and remove the blood. There is some science to that, because in varicose veins, blood accumulates in the legs. So removing with the leech helps, but it doesn't really work. It just, it is first of all very temporary. Second, we don't know what's in the leech's mouth. We don't know where the leech grew up. I don't know what it's eating. So you may get infections through that. So I'm not a big fan. Currently, especially when we have such high quality treatments available, it's not a good thing.
We are already having better options. So
correct.
So I've also heard that recently AI is playing major role with Avis Hospital and this disease also. So what is AI role in this disease?
Right, at a customer care level, at a patient care level, we have implemented multiple agentic AI systems across the systems. So we feed all your symptoms into LLM. There'll come a time, I think in 2-3 months, where you can actually log into a chatbot and identify if you have varicose veins. You can send a leg picture photo also, it will tell you. So we're doing a lot of pattern recognition and fed a large LLM into this, right? We have our own, we're feeding our own LLM. But having said that, that's at the customer care level. At a technology level, we have a lot of augmented reality usage where we identify the vein using an augmented reality viewer, which identifies the problem on a back projection system. So all these are very, very new technologies. 99% of the clinics in India cannot even afford. For example, that vein viewer we use with augmented reality, that alone is 24 lakhs, right? So to identify the vein only, you're spending 24 lakhs, right? So nobody can afford that kind of equipment. So that's where I think having a big system where we see hundreds and thousands of patients across the country over a month. In a month, we see nearly 3,000 patients. Having such a big system, seeing multiple patients actually helps us get more proficient in what we do, helps us do more cases and all that. So I think there's a huge angle of scale Of having a good scale will give you better technology, better access to technology, more money to spend for technology, which improves patient care further. So this is a very self-perpetuating kind of a cycle, which is very, very helpful to our patients.
But again, that was a great idea. So I've also heard that people have been using stockings for 2 or more years and ended up having no relief. And again, they are starting the treatment. So what is stockings role here? What type of stockings would be there?
So that in the type of stockings, very important. Remember that you have to wear only medicated stockings that are made by reputed companies, and that are there. So the name of the stocking is graduated compression stockings, which means
so they are not normal socks.
First point is that it is not normal socks. You cannot replace by putting a little bandage around your leg. That is useless. By putting a crepe bandage on your leg, it serves no purpose. So GCS means there's a different pressure here, there's a different pressure here, there's a different pressure here. So it has higher pressure below and little lower pressure up, so that the blood is like milked. It gets milked to go up. Now the point with that is it is suitable only in some people. So you need to identify who are these people, right? So traditionally what happened is most of our literature gets published in the Western world. There what happens is, a lot of people want to wear shorter clothes, they want to go to beaches. So the insurance companies don't want you to treat every early venous problem. Hence they developed a technology where you wear the stockings and report your findings for 2 months, 3 months, 4 months and see if you get improvement. And if you don't get improvement, only then the insurance company permits for procedure. In most Western countries, nobody pays from their pocket for healthcare. Now, to plug and play that in India is very, very difficult. In India, we have a lot of problems. It's a very hot country. You cannot wear stockings easily. A lot of old people have to bend down and wear stockings. It's not easy. And then the stockings become very dirty. Then they have a lot of sweat collection. So all that. So in India, in my practice, when I came back from US, I used to write stockings very diligently to everyone. And they used to come back and scold me. What is this nonsense you've written? I'm not able to manage at 40 degrees outside. I'm a salesperson. I have to go to 20 different clinics today. How can I manage with stockings? So this became a challenge for us. So we feel that stockings doesn't work in all cases. There are only select cases where early varicose veins or very old people or high risk patients where we use stockings. And most other symptomatic varicose veins, we prefer to do the procedure and give you relief in a better way. Having said that, there is some role for stockings. But one thing I need to caution you is that the stockings you'll have to wear for life. And by wearing for stockings for 2-3 weeks, the varicose veins will not heal. Right? It's very important to remember that. So varicose veins to heal will require a procedure. Stockings control varicose veins. Stockings don't cure varicose veins. It's very important to remember that.
I think we also have some types of these vein diseases like spider veins, varicose veins. Do you have any other like this?
Yes. So basically there are 6 stages of varicose veins. Spider veins is nothing but early varicose veins. So small varicose veins that look like small spider legs are spider veins. So in first and second stages you see small veins. First is spider veins, second is slightly bigger veins. In third stage we see a little bit of pain in the legs, little bit of swelling in the legs. Legs start assuming a different color. And in fourth stage you actually see black color discoloration in the legs. In the fifth stage we see small ulcers. And in sixth stage you see big ulcers, which also is sometimes called as gangrene sometimes. So there are different stages of varicose veins. Again, effectively spider veins to ulcer, you should be able to treat all levels of disease. And for that, different skill sets are required. For spider veins, we'll wear a magnifying lens, we'll put augmented reality and keep on chasing every vein. Whereas for ulcer, you require a multidisciplinary team that does bandaging every weekend to reduce ulcer. So we need to have that whole entire system. Again, only a system like ours, you afford to build such a big system that can take care of end-to-end vein care.
Yeah. So we have separate treatments for these 6 stages.
Correct. It's not separate, but you should have additional steps you take to satisfy the patient. So just by doing the inner vein and leaving all spider veins, a young lady who wants to wear shorts will not be happy. She requires the small veins to be treated. Same way, if I do the varicose veins and leave the ulcer, the wound like that, then the 6th stage fellow is not happy. So I need a wound management team. So all I'm saying is venous disease is same. And it requires similar equipment. But you need to have the spectrum in your mind and the ability and experience to treat across the spectrum.
If that is the 6th stage, are we having any chances of removing leg or?
Right. So amputation is very common in India, and we say that amputation, makes the family suffer a lot. A lot of people have to assist him, help him, do with the day-to-day chores. But luckily, we've been very lucky in our hospital experience. We have less than 2 times maybe in my life I said, we cannot do anything for you, you require an amputation. And remaining all, we managed to save the leg. We managed to go there and do the procedure, do lots of post-operative care, by which the leg got saved. So we have saved nearly more than, I think, 1,000 legs in our lifetime, which were about to get amputated. We gave them new life. We could make them walk again. So it's all wonderful, wonderful things that have happened in our center. But it's all because of the end-to-end vein care and extremely high quality equipment that we have.
Okay. What is this end-to-end vein care, sir?
End-to-end vein care means, early varicose veins. You can do that little patches. We do a procedure called clacks that takes care of the early varicose veins.
Okay.
6-stage advanced varicose veins, my wound care department will put special bandages to reduce the ulcer. So we have the end-to-end, the entire spectrum we can treat you.
Okay. I've also heard that it is the patient should be discharged in just 1 day.
Correct. The patient gets discharged same day, not even 1 day. So we do the procedure within half an hour, 40 minutes. We send you home if you were, from our medical standpoint. This is also again enabled because our machines are brand new. Because by the time we take you to theatre, we've already done this so-called mapping. Remember, I told you color Doppler, we map every patient. The map is there. So in our mind, we know exactly what to do for what patient. But also, if I do only this procedure, my expertise also gets higher. Same me 10 years ago, I was taking 1 hour to do it. Now I can do it in 12 minutes, right? So all that expertise, that hand skill, everything improves when you do one specialty well. This is going to be the future of healthcare. We'll have multiple single specialty people taking over healthcare.
Are there any chances of this treatment failure, sir? Like, let's assume a person got varicose veins disease in early 20s. He got cured and free from the disease. And is there any chances of getting after 30s or 40s?
Right. So we're talking about recurrences. So varicose veins recurrence after a successful surgery is 2 to 5% as per the literature. As per the books, if you do in 100 people, 2 to 5% happen. Now there are 2-3 take-home points from this. Why does it recur? It recurs because of genetics. Okay. Mostly. Sometimes it's doctor skill, sometimes it's your scanning ability. So whatever the skill and ability, we are good at it because we do our own scans. If it fails, again we do our own scan. All that we do thousands of scans also. So one patient have done 50 scans also. Right? All the color Dopplers are free with us. But sometimes it's your genetics also. Right? Like I said, it's 94%. It's genetically inherited problem. So definitely that angle is also there. But having said that, we need to understand that if some internet website is promising 100%, or some patient is expecting guarantee, warranty, it's not going to happen. Right? It's not going to happen. You need to be aware of that. So we need to be aware that this is a fairly successful procedure, but doesn't mean that it's automatically successful every time. And in our system, what we do is anybody fails, we do the procedure free of cost. About 5 patients have done free. If anybody's come back. But fail is not the word for that. The word for that is recurrence. The recurrence chance are 2 to 5% as per the literature. In our experience, less than 1% actually.
Okay, nice. So I've also heard that Avis Hospital is taking a great initiation going to rural areas and providing some free camps, not only spreading the awareness about these varicose veins, but also providing free treatment for them. So what's the reason or idea behind this great initiation?
So I love healthcare and I love giving back. And hence we do lot of rural free camps. To date, my consultation in my center in Hyderabad is 249 rupees. So I'm very approachable. My scan is free of cost.
Yeah.
So all that. So my aim in life is to take an under-recognized problem. Hardly anybody knows about this, and make the barrier so low for you to realize the problem or understand the problem that it should not be a barrier. You should just come and spend $250 and you'll be getting it. And if you go to my rural camp, it is free. Everything is free there. We give you medicines also free. So we create this whole entire thing instead of spending it on some fancy advertisements or fancy posters or fancy doctor lunches and dinners. We went and gone to people and given everything free, right? Or everything at the lowest price possible. So that's where the attraction lies. That's where we actually get our patients from, and that's where we create a big force behind us. Today, I don't have a marketing department. My entire this thing is directly to the people and directly I tell the people what the problem is.
Yeah. So you are started with 3 branches. Now it is 24 branches in 5 states. We're already seeing the success rate and success growth. So what is the reason behind this success?
Right. So one of it is, we've been working very hard at this. It's not been an accident. We've had success stories, we had failure stories. Somebody did not succeed, some patient, but we've been very humble. If some patient did not succeed, we've gone and asked why you did not succeed. How can we help you? We've done sometimes free surgery, free of cost, if something has failed from our end. At the same time, we've maintained a focus on vascular care alone. We maintained focus on making our patients talk for us. So how do our patients talk for us? if we are transparent in a price wise, right? So in 10 years, the price has started in 2015 is the price I'm charging today.
Okay.
My OPD consultation is only 249 rupees.
Oh.
So I've not increased the price. Like for example, if you see any major corporate, they're saying price has to increase 6 to 8% every year to match the expenses.
Yeah.
I have not increased it. So I maintained that, by having a direct approach to people, cutting the middle layers, cutting the marketing teams, I can approach the patients in a very transparent way. Whatever price we agree upon before the surgery is what you pay at the end of the surgery. So far, in my 10 years, there's not one fight at the time of discharge saying you've charged more. Today, if you open up any social media, there'll be so many complaints that this doctor said so much, and then by the time discharge, they said so much. So many complaints are going around. We've never done that. We've kept a very, very, very clean whistle. At the same time, we've invested in best technology, and we're stuck to one specialty that we can do well. So we didn't go to multiple specialties. I think this is going to become the future of healthcare.
Yeah.
And this is where we've done well.
Unlike other doctors and hospitals, you have chosen a different path actually.
Correct.
You are only seeing the patients who are having this varicose veins disease only.
Correct.
So have you seen any people near you or like in your family and come up with this idea?
Yeah, well, it came up because I'm actually started in very poor background. I'm a very middle class person, but I was lucky enough because I studied well to go to US, UK, seen multiple systems. But then see, because I came from such a humble background, I always wanted to go back and change what I could change. So hence I came back from US.
Yeah.
But it's been a good journey, and so many poor people get changed, lives get changed. I mean, if you see a casual daily worker, and if he has a leg ulcer, he cannot go and work for his own foot. It's not like, as office going people or something, right? We can go with ulcer, a painful leg, somehow we can sit on a desk. But some people are depending on the legs to work. A salesman is there. I still remember my second patient was a juice shop owner on Vizag Beach.
Okay.
I mean, he's the most popular juice shop owner, right? And he always says, he still comes to me after 10 years and says, sir, because of you only, I actually, in fact, he shut his center. He cannot stand all day and make juice, right? So many lives depend on it. India is still a very, very, very people-dependent country. And, whatever technology you talk, technology doesn't give you money. Finally, you need people, right?
Yeah.
People have to be working and they have to be healthy. Seeing this rural and a huge impact that we make on middle class and lower middle class people is why NABARD has invested with us. It's a rural development bank. So I think we hitting all the right notes here. And all that is because where I came from, and I feel I always have to give back to that section of the society.
From your words itself, I can understand what is the healthy relation you are maintaining with patients.
Correct.
Actually. We are so grateful to have you in India, sir, because India needs your kind of doctors a lot. Yes, and what is your future goal? What is your future plans?
So future plan is, at an individual level, somebody should write and say, one guy who doesn't come from a dominant community, who comes from a very backward community and who comes from a very backward place, could set up a national chain of healthcare. I think that story should be written after me or before me, after my resign or retire. But at a healthcare level, at a policy level, I think this vascular care is very under-recognized. Southern states are still better. In North, so many thousands of people are suffering with this disease. And I think it will be a fantastic day when a person from when I started Hyderabad, it was called a B town or a C town.
Okay.
From a guy from a B town has created a national impact in healthcare in India. And there'll be some exciting times to come. I'm very excited to see that paper cutting on that day, maybe 10 years down the line. So I plan to have about 80 to 100 centers pan-India and grow.
Thank you so much, sir. Thank you so much for your time. Hope this video is informative and useful for you. So I think we have spread a lot of awareness about what is varicose veins and why it is important to understand the condition of varicose veins. If you have any related symptoms for varicose veins, please do visit the hospital. Don't neglect this disease. And in our Avis Hospital, they are providing free tests, and the consultation fees is also just 250 rupees. So I hope I've got your queries resolved. If you have any queries related to varicose veins, please comment down, and also there will be a number scrolling down. So please make a call and make your queries resolved. Thank you so much. See you in another video.